presentation will demonstrate the major topographical features of the forearm, wrist, and hand. The subject is in the standard anatomical position with the extremity extended at the side of the body and supinated. Hence, the palm is facing forward and the thumb is directed laterally. The major proximal bony features concerned with the forearm are the medial and lateral epicondyles of the humerus, with the supracondylar ridges and the olecranon process of the ulna. From the olecranon process, the dorsal subcutaneous border of the ulna runs to the styloid process at its distal end. The distal end of the radius also has a styloid process at its lateral border. And dorsal ridges, the most conspicuous of which is the dorsal tubercle of Lister. The radius articulates with the ulna proximally and distally, but only the radius articulates with the carpals distally. Most of the fleshy mass of the anterior forearm consists of muscles that flex the wrist and digits. Hence, the mass tapers toward the wrist as tendons are formed. If flexion is attempted against resistance, the muscles are seen to arise superficially from the medial epicondyle and vicinity. Their upper border passes obliquely from the epicondyle to the lateral side. It reaches the radial border of the forearm about 1/3 of the way down. This border is formed by the pronator teres. This is also the medial border of the cubital fossa. In other words, the muscle group covers all of the anterior surface of the forearm except the upper radial quarter. It also extends around the ulnar border onto the posterior aspect of the forearm as far as the dorsal subcutaneous border of the ulna. Most of the fleshy mass of the posterior forearm is formed by muscles that extend the wrist and digits. It also tapers toward the wrist as tendons are formed. The group is more conspicuous if extension is attempted against resistance. The muscles can then be seen to arise superficially from the lateral epicondyle and supracondylar ridge and vicinity. They cover the posterior aspect of the forearm as far as the dorsal subcutaneous border of the ulna, and also extend onto the upper radial quarter of the anterior surface. The most medial muscle is the brachioradialis. This is also the lateral border of the cubital fossa. This muscle is conspicuous when flexion at the elbow is attempted from a semi-pronated and flexed position. Distally, at the level of the proximal wrist crease, both the radial and ulnar styloid processes are palpable. If the anterior and posterior aspects of the wrist are gripped at this level, the radiocarpal articulation can be located when the hand is alternately flexed and extended. If the distal end of the ulna is gripped and the forearm alternately pronated and supinated, the radio-ulnar joint can be identified, and the rotation of the movable radius around the fixed ulna felt. In pronation, the palm faces posteriorly and the thumb is directed medially. The radius is crossed over the ulna. The significant carpal bones of the wrist are the pisiform on the ulnar side, with the hamate and its hook distal to it, and the tubercle of the scaphoid on the radial side. The pisiform is palpable immediately distal to the distal wrist crease. The hook of the hamate can be located by deep pressure just distal and slightly radial to the pisiform. On the radial side, again just distal to the distal wrist crease, the scaphoid tubercle is palpable. On the palmar surface of the hand, a hypothenar eminence passes from the region of the pisiform toward the fifth digit, or little finger. A larger thenar eminence passes from the region of the scaphoid tubercle toward the first digit, or thumb. The eminences are formed by the intrinsic muscles of the respective digits. They overlie the fifth and first metacarpals. Between these eminences is a triangular area with its apex toward the wrist and base toward the digits. This area is particularly resistant to pressure owing to an underlying thickening of deep fascia, the palmar aponeurosis. If the wrist is flexed against resistance, particularly with the digit slightly flexed, the prominent tendon of flexor carpi radialis stands out in the lower forearm as it passes toward the scaphoid tubercle. It lies just to the radial side of the midline of the wrist. At the same time, the less obvious tendon of flexor carpi ulnaris can be palpated on the ulnar border of the wrist, passing to the pisiform bone. If the fingers are alternately strongly flexed without wrist flexion, as in making a fist, and relaxed, a group of tendons are seen between those of flexor carpi ulnaris and radialis. These are of long digital flexors, or flexor digitorum sublimis. The four tendons of flexor digitorum profundus underlie these. In most subjects, a thin but prominent tendon will stand out over those of flexor digitorum sublimis. This is that of palmaris longus. It passes into the palmar aponeurosis and may be absent in one or both extremities. With the digits and wrist relaxed, the pulse of the ulnar artery can be detected just proximal to the proximal wrist crease and on the radial side of the tendon of flexor carpi ulnaris. The ulnar nerve lies with it, but is not palpable. Both artery and nerve enter the palm between the pisiform and hook of the hamate. At the same level, the pulse of the radial artery can be felt on the radial side of the tendon of flexor carpi radialis. This artery passes around the radial border of the wrist to the dorsal aspect. The median nerve becomes superficial temporarily between the tendons of flexor digitorum sublimis and flexor carpi radialis at the proximal wrist crease. It then passes into the deep palm. Its recurrent motor branch to the thenar eminence is also superficial, about 3 centimeters distal to the scaphoid tubercle and on the ulnar side of the eminence. Note that the exposed position of the above tendons, vessels, and nerves renders them particularly liable to damage in this area. Major bony features of the dorsal wrist and hand are the 5 metacarpals with a proximal and distal phalanx on digit 1 and a proximal, middle, and distal phalanx on digits 2, 3, 4, and 5. The metacarpals and phalanges can all be palpated. The distal ends of the metacarpals and of the proximal phalanges are prominent in the clenched fist as the knuckles. The metacarpal phalangeal and interphalangeal joints are identifiable in flexion and extension of the digits. Notice that the distal palmar crease corresponds to the metacarpal phalangeal joints of digits 2, 3, 4, and 5, and the distal finger creases to the distal interphalangeal joints. Other digital creases do not overlie adjacent joints. Various extensor tendons cross the dorsum of the hand to the carpals and digits. They are more conspicuous if the digits are extended at the metacarpal phalangeal joints, but flexed at the interphalangeal joints, while simultaneously being abducted to form a claw hand. Then tendons of extensor digitorum communis can be identified passing to the proximal phalanges of digits 2, 3, 4, and 5. These tendons enter the wrist on the ulnar side of the dorsal radial tubercle. Notice that these dorsal tendons are particularly at risk, as they, unlike the long flexor tendons of the digits on the palmar aspect, are not protected by muscles or a thick aponeurosis. The web of muscle between digits 1 and 2 is formed by the first dorsal interosseous, with the adductor pollicus deep to it. The other 3 dorsal interosseous muscles are palpable between the metacarpals. Atrophy of these interossei is an indication of ulnar nerve damage. When the thumb is extended and abducted, the tendons of abductor pollicus longus and extensor pollicus brevis can be seen and palpated as a single entity passing across the styloid process of the radius to the base of the thumb on the radial border of the wrist and hand. Medial to these, but converging on them at the base of the thumb, is the tendon of extensor pollicus longus. The triangular area between the 2 sets of tendons is the anatomical snuff box. In it, the pulse of the radial artery that has passed from the palmar to the dorsal aspect of the wrist can be detected. This concludes the demonstration of the major topographic features of the forearm, wrist, and hand.